kind of fast for a lot of folks, but it's not something that's being undertaken lightly. Healthcare is a mess. Most of us are paying insurance. Some of us are lucky to have it provided by an employer or maybe through retirement. Healthcare in the United States is a mess. Healthcare in rural communities in the United States is even more of a mess. In the last 6 years, 23 rural hospitals have closed in Texas alone. This is not a Grange or Fayette County issue. This is a much bigger picture. Not here to talk about the Affordable Care Act. Some people call it Obamacare. We're struggling as a hospital. Most of you know, most everybody's probably been around here long enough. Some of you may be newer to the community. But we opened St. Mark's Medical Center on July 11th of '05. Okay, so it's 14 years this summer. It's the third hospital serving our community. There's some that are here. Began to outlive its useful economic life. So in 2000, we were lucky enough to hire a young man named Kelly Oliphant, who was out of, I think, the Memorial Hermann Hospital System. He came out here and put a committee together. We initially called it the Fayette Memorial Foundation. It has since become the St. Mark's Medical Center Foundation, something that I have proudly served for the last 20 years this year. So Kelly looked at it and said, look, the flat roof hospital is going to outlive its economic life.
But Ken Darnell is the man in charge. Is that right, Mr. Corker?
Here's what's going on.
I know the Darnell name.
We had farmed a group to oppose the hospital. And this meeting tonight was not originally a public meeting.
Why not?
We weren't ready for
Why
it.
We weren't ready.
It was a very spontaneous thing. This vote is coming up very quickly. Why is this coming up?
Because we're just getting our group together.
No,
I mean-
but I'm asking, why is this being pushed through so quickly?
Oh, that's
that has
totally
to be
right.
like
Yeah, no, I
before.
agree. But we have a group that we farmed to oppose it. Mike showed up, so I'm letting him speak.
get the answer for you.
So, so let's just start taking questions, and y'all can talk amongst yourselves and ask each other, or us, or Ken, go ahead.
I got a whole list. I don't know that you can answer, but I would like to hear if you can. First of all, how much revenue will the 10-cent hospital tax generate for St. Mark's next year?
Based on 2018 taxes, 10 cent per $100 valuation will generate just north of $3 million.
Okay.
The estimate from the chief appraiser was 3.1 million. He said you have to be flexible because people die, new people move in, and the numbers may. Day-to-day operations, the board sets the guidance and the vision, and then hires, either like we did in 2000, an individual like Kelly Oliphant. In my humble opinion, those days have changed. Medical care is now such a debacle that no longer one person can run it. The reporting for the government, for the insurance agencies, and those type of things, the time and effort involved, the IT side, you need a little bit bigger management team.
Okay, but what's gonna be the difference? You started out with a board of directors from local residents. That didn't work. Then we went to a professional hospital
Springtime is not as good a financial time for the hospital. So a district.
What's the difference between, in your opinion, between Columbus Community Hospital and LaGrange St. Mark's? What's the big difference there?
My personal opinion
Yeah.
is the fact that we built a 100,000 square foot paid,
mortgage, Mike, the current mortgage?
yes.
Okay, thank you,
Current
so that's
mortgage,
currently
yeah.
paying.
That's the
Okay.
current mortgage. And it started at 28 million. The original mortgage.
I've got a question. If the district's created and the hospital goes under anyway, then the taxpayer's gonna be on the hook since we took it over for the outstanding mortgage, right?
Well, the district can be dissolved by taxpayer vote.
But unless it's dissolved, then we'd be on the hook for whatever y'all vote, the hospital vote.
District has to be a hospital. There's no hospital, there's no taxing district.
The gentleman in the back there.
It is my understanding, when you built this new building, folks, that Ron Paul, as our representative, was instrumental in getting a grant which helped get it started. Have we made any effort on the hospital staff to solicit some federal money to do the same thing now to help with this debt that we are struggling with?
Good question. I know that the board and the management has looked at lots of options. I don't know about federal grants.
Why don't we do that?
I'll certainly
Y'all said the mortgage payment on the building is $140,000 a month. What is the outstanding note?
it's about 15 million, a little under 15 million.
So with the 15 million, we have an essentials, what y'all put out of like 2.4 million. So you'd have 17 point something million, give or take, that's gonna, of liability, and then only a revenue of 3.
what's going on in those counties right now. They both have hospital districts, is that true? Walker County does, and
There are hospital districts around us in rural Texas,
and
that
things
is
are
true.
not working out well,
Oklahoma,
and they're hospital
Hallettsville.
districts. So what would be the difference? I don't understand.
The difficult times, and this is part Affordable Care Act, cuts of Medicaid and Medicare, Texas not expanding Medicaid, there's a number of reasons there.
If we are assuming, payments for people that do not pay for indigent care, then
I mean,
absolutely,
you have to
according to
clarify,
state
what do you mean by
statutes, that
indigent?
we
No,
can
no.
be taxed up to 70.
What do you mean by indigent care? Do you
Can I
talking
finish?
about,
May I
are you
finish?
talking about no insurance and not gonna
Yes,
pay it off?
but let me finish.
Okay, that's probably less than 10%. Now, we have
I
another,
don't think so, because I don't think that we qualify, I think it's 11 point something percent to qualify for some of the things that I read today. So,
but our list of like no insurance,
yeah,
zero
for the
insurance.
disproportionate share hospital, which is what we are.
Right,
That's
but
how
we
we're
didn't,
listed-
we
that's
did
how
not
we're listed
qualify,
in
we
the
did not
state.
qualify for dish payments. We haven't qualified for dish payments for several years.
Oh, really? So it's
And then we
less,
actually were awarded dish payments and then we had to pay
okay,
it
so
back.
it's less than 10%?
So when you look at like 2017, Like you say digress from how?
Financially.
But you're talking about, you mean getting better?
No, digress, the other one. Why
But what are you
asking
talking about? Where were we digressing from though?
part of
I mean, I
this?
don't think from 2009, it's not like we've been flowing with cash.
Right,
And,
and
you can go into this
according to
business
what I'm
Hospital was planned and
Correct,
all.
when it was
You didn't
open.
realize you were gonna
Correct.
have to do, okay, I was just
so
wondering.
that was taken
So
on,
that-
that led to, that on itself, if anybody has any service contracts and all that, that led to that. That was additional debt we had. We did have the breach of, what was it, the security breach on that health system.
Ransomware.
With ransomware, we were held up for several months without any collections and so forth. Also, the electronic record also altered our ability to collect even once that was out. We had to find ways to cope with that. So basically, I know a lot of our outpatient surgeries, our cash register wasn't working. We weren't able to collect. So there's been a lot of stuff, mistakes made. Again, I'm probably not even covering them all, but that's what happened. So, but I think since, for the past 18 months, 24 months, we have done a lot of internal changes and gotten revenue back. Getting back to the question about the mortgage debt and all that, you know, I think we do pretty well until we write that check. Okay? Asking about Columbus, what does Columbus have different? They don't have any debt. They don't have to write a $150,000 check every month. So I think we've made changes. We've made changes and they're carrying forward. Currently, we have a board that's on there. It's a self-elected board according to the bylaws. Currently, that board is elected to still have CHC run the hospital. Will that change? We don't know. But we have what we have right now. Talking about a strategic plan, yes, there's a strategic plan. You know, what it is, I can't really tell you right now. Is there gonna be new services or will it be L&D back? No, I don't think so. So the idea is if it doesn't pass, we have a strategy, that's what we're gonna continue to do.
But as a business deal, because that's what you guys are asking, you're asking the community to come into a business deal with you. And as a business deal, nobody is you are not gonna give me your money and let me open a business without me telling you what the plan is.
Exactly.
Well, the
And
plan
I don't
is, we
think
go,
it's
well,
fair for
again,
you
and
to come
maybe you don't
and
wanna
ask
hear
me
this,
and not tell me
maybe you don't
what
wanna hear
you're
this, but it's
doing
up to the
with it.
board. This new board that will be elected. I sit on the board right now,
And it's gonna do.
but that's gonna go away.
That the elections need to be delayed.
Then you
What's
need
that?
to get the information before you take my money. This is a business deal.
It could've got put on there.
Yes.
Well, a standalone issue, whether it's a school bond or whatever, has a better chance of passing. That's
Because
a
people,
strategy.
especially in the summer, people are on
Right.
vacation and they're not here to
But
vote.
we didn't hear nothing about it until it went to Commissioner's Court. That's when I heard about it.
Exactly.
And my big concern, and I'm sure yours too, the 10 cents is just a carrot. It's gonna go to a quarter.
Yeah, 10 cents is what we say, but it's up to 25.
Right, at a quarter,
So it's gonna be
$200,000
a
home, that's
quarter.
$500 a year. And I mean, they're talking about affordable housing in Grange. You can't afford to pay taxes, I don't care what the house costs.
Yeah.
But that's some of my concern, and some of y'all's too, I imagine, but I'll get back to that. Let me get that gentleman back there, you had a question, also, and I get to you.
I had a question about the propensity to collect bills. And I didn't hear an answer to that. What percent are you collecting of invoices?
We are currently collecting, it's hard to believe, but I see the numbers. We're currently collecting more than 100% of the bills that we send out. we're averaging about 103%. Days from a year and 3 or 4 months ago, because things got out of whack and the billing department wasn't keeping up with things. So at that time, we struggled. Now, we've got people focused on specific billing in a timely fashion and monitoring the income from it. And last month, it was 103%. So we sent out $100 worth of receivable bills and invoices. We got $103 back. So that's
paying more money.
no, it's old bills.
It's the old bill.
It's old bills.
But you're still sending out, that's just.
Well, what's your average account?
So we're sending out the.
100% of what you're billing.
Oh, they know better than me.
No, what,
Let me
I
get this.
guess-
Go ahead.
Can't collect more.
Go ahead.
I wanna get back to the financial stuff of this. Okay, the CHC, the payment, the debt payment that we have to them. Are we gonna see any kind of financial breakdown on that? It says salaries and all this stuff on there. How much are these folks, I don't know what the management situation there was, but if we're taking a debt for what they billed for their management services during the time that they allowed this to go run into a deficit, I do not believe that should be paid. First of all, they need to negotiate on what that debt is. I don't believe that we as a taxpayer should somehow assume this, they're gonna get out scot-free and we're gonna have to take on their, even though, hey, they ran it bad, here you go, dish it on to us. I'm not for that. And is there gonna be something released showing y'all's financials to make this public before this vote? I mean, we ought to see some kind of financial statement from, I don't know.
Put us in this situation.
Of the 3 people you mentioned, Tammy Hartfield and her husband live in Lee County, over the Fayette-Lee County line. She's our chief nursing officer, has been with the hospital, I think, since Fayette Memorial, if I remember correctly.
16, 17
So her salary is paid by St. Mark's Medical Center. The other 2 individuals you mentioned,